Good afternoon, everyone. Just going to hang on a couple of minutes, let a few people join first, then we'll begin. So I can see we've got a few people join now, so let's get started. So thank you to everyone for coming along. This is COVID-19 Managing a Pandemic webinar. My name is Matt Ellis. I'm going to be the host today. I'm a Senior Health and Safety Advisor based at head office. I personally have been with the company for over 6 years now. I've got a large client base working with a lot of clients in the education sector, construction, and also manage a lot of fire safety related business. So I'm going to be passing you over to different speakers for the next hour or so. But first of all, we'll just take a little bit of a look at Style Arcane. So who are we? So we was founded in 2000, which obviously means that we are celebrating our 20th anniversary as a company this year. We was founded by Richard Kane and Isma Ali. So since 2000, we've developed four main arms to the business. So the first one being health and safety. So as a lot of you are clients, you'll understand what we're about, but for those who aren't, so we can provide tailored health and safety services to businesses of all sizes. We work in and have experts in a whole host of industries with consultants based in Lincolnshire, Yorkshire, Midlands and London. The next arm of our business, so HR and Employment Law. So we've got employment law experts assisting organisations with all sorts of human resource needs, things such as contracts of employment, employee handbooks, grievances, disciplinary procedures, just to name a few. And training. So we all know the importance of training. It's an essential part of a sound health and safety and HR management system. We can provide a wide range of training courses to support both types of management systems, from things like IOS managing safely, UCATA asbestos awareness, face fit testing, plant and equipment training, many, many more. And the last part of the business and newest part of the business is SK compliant. So this part of the company complements the above services. So this means that we can offer comprehensive solutions to any type of business to keep you guys safe and compliant. So it's a wide range of inspections, surveys, assessments that can all be provided as individual services or as part of a package. So you can find more information about us at stylearcaneassociates.com. Feel free to contact us at our head office, 01427 678 660. And feel free to email admin@skaltd.co.uk. But of course, if you're an existing client, feel free to email any questions to your consultant. So just a bit of housekeeping, guys. So some key information. The Q&A function, please use that if you've got any questions for the presenters. This function will be moderated by our panelists. We've got some non-presenting panelists, Senior Health and Safety Advisor Dave Walton and Senior HR Advisor Ben Crawford. They're going to be moderating these questions and passing relevant ones to myself to ask the presenters after each presentation is finished. Ones that we don't get around to answering will be covered in on our website afterwards, so you should get an answer to your question one way or another. The chat function should just be used for technical difficulties, please, guys. So this is also moderated, and any technical difficulties, hopefully there won't be any, but any technical difficulties should be answered straight away. There'll be a brief poll launched after each presentation, just some thought-provoking questions. Want it to be as interactive as possible for you guys. So I'll be asking some key questions which will allow you to reflect on the measures that you have in your business and whether there's anything else you maybe need to think about or anything else that you can ask us for assistance with. And a recorded version of this webinar will become available on the Style Arcane website. We will send a link to all attendees and anyone else who expressed an interest in the webinar once that video is available. And as mentioned, not all questions might get answered, but we will be looking to provide answers to them on our website shortly after. So today's presentations, we are going to start off with managing home workers. This is going to be delivered by Chris Bartley, one of our Senior Health and Safety Advisors. We'll be moving on to mental health tips for staff working from home as well as staff on furlough. This will be delivered by Faye Bevington, our Training Manager. The workplace travel and PPE. This will be delivered by Sue Allen, Health and Safety Advisor. And last but not least, the Coronavirus Job Retention Scheme delivered by Claudia Williams, HR Advisor. So I'm going to hand over to Chris now. Good afternoon, Chris.
Is that screen working?
It is. Over to you, mate.
Hello, everybody. My name's Chris Bartley. I'm a Senior Health and Safety Advisor at Stallard Kane. Been working for the company now for around about 9 years. And I manage a team of consultants based out of our Northwest office. We've been working from home now for several weeks. And what I wanted to talk to you today about is managing home workers. So this section of the webinar is aimed at employers and managers who are managing personnel working from home. And we'll be covering the following: the challenges that people face when working from home, what employers and line managers can do to ensure a smooth transition into home working, and what Stallard Kane has done as a company to assist our employees and our home workers. I'm also at the end going to be giving you some tips for those of you who are going to be organising, planning and carrying out meetings remotely now, because you'll still need to carry out meetings with clients and different teams, but it's how we're going to do that remotely and some tips so you know how to do that effectively. Okay, so we need to ask ourselves the question, why do we now need to concentrate and look at managing remote workers appropriately? Okay, well, over the past few months, due to COVID-19, many companies have had to dramatically change the way in which they work, with many having to now work from home where they can. Okay, so many of you and many companies will never have worked from home before. So you'll have had a lack of preparation, or in certain circumstances, no preparation whatsoever. It sort of picked up pace quite quickly as soon as sort of the lockdown measures started to come into force. So you wouldn't have seen that, or you wouldn't have identified that when it happened. So it's what we call an unforeseen event. So in health and safety law, you're expected to identify the reasonably foreseeable risks. But COVID-19 and having to work from home is, as I say, unforeseen. So when you do your risk assessments and you put your management system in place, you generally plan to reduce the risk of these sort of events, or reduce the risk to the employees and the business. You've not been able to do that in this circumstance, so you'll have had no planning, no preparation. So what you're finding is that you're reacting to a situation, then an event that's already happened and is progressing all the time, as we're all looking every day to see what's coming out in the news and in the bulletins to see whether, you know, they're relaxing measures, whether measures have been increased. So we're always adapting and we're implementing control measures after the event. Now, without a doubt, it's always good to be proactive and have systems of work in place before any hazardous event happens. As I say, we've not been able to do this. We've had to react in this situation. So you're going to face many challenges, especially when working from home and when you have remote workers and you have to manage those remote workers. Some of those challenges that you might face are a change in what is expected. So there may be a change in workloads, okay? So workloads may have increased now because you're actually covering, employers are now covering work that would normally be covered or carried out by those that have now been furloughed. So the workloads have actually increased. It may have decreased due to a lack of client activity or because of the government restrictions, the change in the way that we have to work. So a lot of your employees may never have worked from home before. And we might find that communication has changed and is a challenge now. Your employees will now be no longer have that face-to-face contact that they're used to. Okay, and that could be with the colleagues, with the clients, or with the customers. So you need to look at new lines of communication, and there are various ways that you can do this, such as video conferencing, video calls, or just good old-fashioned phone calls. And there are a number of platforms that you can use. So we're mainly using Microsoft Teams, but there are other platforms available. You're all on Zoom at the moment, so that's another platform and system. There's also Skype and Fuse. It just enables you to carry on with that communication and keep that workplace atmosphere going. The actual workspace that your employees have at home may not be suitably equipped. Obviously, because we're reacting to the situation at the beginning, when we made it available so we could work from home, some of the equipment and the facilities may not have been available to source at the time. So we've had to sort of make do with what we've had. I mean, Stallard Kane have allowed their employees to take office equipment home, such as dual screens and hand rests and even in certain cases, office chairs. There may be a lack of information or facilities. Some employees may not have access to certain company documentation or internal systems. And you might think it's a bit strange in this day and age, but they may not have internet access, so they can access those systems and facilities like Zoom, which you're using at the moment. But more commonly, it might be poor broadband speed in their area. So that is a challenge. Relationships are going to be a challenge. A lot of people now will be working from home where their partners, siblings, housemates, even parents are also living. And these relationships could come under stress because of this. They might have dependents, so they might have children that are now at home from school for the foreseeable that they have to look after. They might be like myself and have vulnerable relatives that they have to look after. So I have an 87-year-old nan and my mum lives with my nan. So they're shielding and isolating. So I have to do their shopping and I have to drop the shopping off through the window. So I've got to plan my workday around all these demands. And that's the same for your employees. So you've got to look at being flexible around your working hours. And if you're a manager and you're an employer and you're actually managing remote workers, you're going to face some specific challenges. That might be scheduling appointments and meetings. Not everybody's going to be available at the same time. It might be, you may have issues with trust, but you've got to learn to trust your employees to work unsupervised. And performance tracking may be a challenge or an issue. I find it easy to have a meeting, or it's better to have a meeting on a Monday morning with your staff via Skype or Microsoft Teams, set out a work plan for the week, and then have them fill out a daily or weekly worksheet so you can track performance and progress throughout the week. And then it's down to you as managers and employers to step up and make sure that your employees have the right support and facilities so they can work from home effectively. And you want to look at having a number of characteristics. You might want to be a good communicator and listener. So you need to be able to communicate your instructions clearly and concisely, but you also need to listen to the worries and the needs of your employees and understand those needs and understand that not everybody's circumstances are going to be the same. And you need to be supportive. You need to support those that need it, but be aware of those that may need additional support and be aware that not everybody's forthcoming with the support that they might need. Be consistent and be consistent with everything that you do, with the meetings that you set, with the deadlines and with your demands. What it'll do is it'll help your employees set their own routine. And by setting their own routine, it's going to be more productive for them and they'll find working from home a lot easier. And lead by example. If you can show your employees how to work from home, then it's going to be easier for them to work from home. So lead by example. Okay, so what can we do? Well, there's certain things that we can do to ease the burden on employees and make things run smoother for managers. Firstly, what we must not forget is that our duty of care does not stop just because employees are now working from home. We still have a duty of care under the Health, Safety and Work Act to ensure our employees' health, safety and welfare as far as reasonably practicable. We also have a duty under the Management of Health and Safety at Work regulations to carry out suitable and sufficient risk assessments on our activities. So you want to be looking at carrying out a home worker risk assessment. Now, we wouldn't normally advise, or it's not required, should I say, to carry out a home worker risk assessment on temporary home workers, because a lot of the issues are generally chronic. But in this circumstance, because it's unforeseen, it's uncertain times, and we don't know how long it's going to be, it's advised that you carry out a home worker risk assessment. And by doing that, you may identify some common hazards, and that might be display screen equipment or ergonomics, lone working, health and mental well-being, and fire. And if we break that down a little bit, if we have a look at display screen equipment and ergonomics, I've already mentioned to you that you carry out a home worker risk assessment. Now, you can't actually go out to each individual household because you won't be adhering to any social distancing guidelines. You'll be breaking those. So what you need to do is probably do that dynamically over the phone, asking a set of questions so you can establish what each individual employee has or what support they need at home. It might point you in the right direction to providing suitable equipment. You might actually be better off getting them to fill out a self-assessment DSE check sheet. They send that back to you. It'll identify what equipment they need. And they might identify that they need dual screens, that they need keyboards, that they actually need office chairs or other display screen equipment. Now, you've got to remember that you've got to do what's reasonably practicable. And in these uncertain times, not everything's practical to do. So there are practical measures that you can adopt, such as putting a laptop on a box or a book to raise the screen, or even putting a cushion on the chair, and that would raise the position of the worker at the desk or at the table. You need to be able to encourage regular breaks. Now, the HSE recommend that 5 minutes away from the workstation is advised every hour. But in these circumstances, you might want to look at longer breaks or more frequent breaks. That allows for family time and it allows for exercise, and provide suitable information, instruction and training on how to set the workstation up the best and what posture they should adopt as well. Lone working is also a hazard that may be applicable to remote workers, although the actual work that you'll be doing from home is not significant risk or high risk. Home workers are still classed as lone workers and should be treated as such. So you need to ensure regular contact is maintained throughout the day, whether that's voice call or video call. And that'll allow you to be aware of what work-related activities are being undertaken and whether your employees can undertake them safely, and that making sure that they're not feeling isolated or alone. Health and mental well-being is probably going to be one of the most significant risks at these uncertain times. I'm not going to discuss it in full detail now because it's going to be discussed more in the next section of the webinar by my colleague Faye Bevington. But some points to consider are: try to understand individual situations, provide flexible working hours where possible, maintain contact and encourage employees to speak to different colleagues throughout the day, and where required, refer your employees to mental health first aiders or provide details of helplines that they can contact. Like I say, this is going to be discussed in depth in the next section. Fire may also be a hazard now that employees are working from home. Now, it is not a legal requirement to carry out a fire risk assessment on a domestic property, but you might want to include that in the check sheet that you issue your employees or the dynamic assessment that you carry out over the phone. Just a couple of questions regarding fire. And you need to be giving your employees suitable information, instruction and training on how to set up their workplace to avoid fire hazards. Encourage smokers to smoke away from their workstation, as they may have more combustible materials around them than usual. Encourage home workers to check batteries on their smoke alarms. And if they live in rented accommodation, inform them that their landlord is responsible to provide them with such facilities as smoke detection. And get them to check their workstation isn't impeding any escape routes, so in the event of a fire, they can get out safely and quickly. So what have we done as a company? Well, Stallard Kane employees have now been working remotely for several weeks, and we've been learning and implementing systems as we go. We've been carrying out regular video calls between teams and different departments, and also with our clients. And we've used a variety of platforms to do this. Now, as I said earlier, we mainly use Microsoft Teams. But what we've learned is that you have to adapt and use other systems because different departments are using different platforms, such as Skype, such as Zoom, and such as Fume. And that's the same with our clients as well. So we've adapted and been able to use a variety of platforms. In regards to office equipment, as I mentioned earlier, we've allowed staff to take some office equipment home, such as dual screens, office desks sometimes, and even chairs. But you've got to be careful with this. You've got to plan it properly. So what you need to do is make sure there's a supervisor there who plans it so that you know what's being taken, but that every effort is made to adhere to government guidance on social distancing. We've altered the way that we work. So what we've done is we've allowed our clients to have their audits over the phone or via voice call, which has worked really well. To be fair, I've done a number over the last few weeks. We've been flexible with our working hours, and we've trained some of our staff as mental health first aiders so they can provide that support and encouragement to any staff that need that. We've encouraged our employees to spend time with their family under the same roof and take frequent breaks and carry out exercise. And we've relaxed working deadlines as well. Okay, so finally, what I wanted to do is cover some tips on what to do when carrying out meetings remotely, because a lot of you will have to do this quite a lot, may have done it in the past over the last few weeks, but you'll be doing it via Skype, via Zoom, or even conference call. But before the meeting, what you want to be doing is looking at booking slightly shorter meetings, maybe 15 to 45 minutes. It's more realistic time frame, and it's more realistic to have people available for those meetings. Set an agenda and objectives, and send those objectives and agenda out, because then that'll allow your employees to plan for that meeting. Ensure that you're clear on which platform attendees must use, whether it be, again, Microsoft Teams or Skype or Zoom. And during your meeting, you want to direct your questions to specific people. Because of the platform you're using, it's different to face-to-face, and there may be awkward silences. Try not to talk over speakers. And if you're like myself, I've got a dog that barks every time the postman or anybody walks past the front room. Use the mute button when not talking, and then that doesn't distract anybody who is talking. And don't feel like you need to fill time. If you've met your objectives, wrap up the meeting, and that allows time throughout the day to do other activities. And when you wrap up the meeting, wrap it up with key objectives and actions. And what you want to be doing then is sharing those agreed actions and next steps with everybody, and having feedback so you can decide on whether a follow-up meeting is needed or anybody else needs to attend the next meeting. And if you are having a follow-up meeting, book that follow-up meeting straight away when all the points are fresh in everybody's mind. So that's it for this section of the webinar. I hope you found it useful and informative. Next up will be mental health tips for home workers and those furloughed staff. But firstly, what I wanted to do is take some questions. So if I can pass it back over to Matt to see whether there are any questions for me to answer.
Yeah, great stuff, Chris. Thank you very much. That was really well delivered and obviously very relevant at the minute. There are a couple of questions. So the first one came in: how do I maintain social distancing measures when letting staff take office equipment home?
Okay, you need to plan that properly. So you need to carry out a risk assessment. You'll need obviously one person to supervise it, but give each individual employee a time slot so not everybody's turning up at the same time. If you just said, oh, come on, pick some stuff up from the office, you might get everybody turning up at once. And if you like us, you might have 30 or 40 staff turning up at once.
That's great, thank you. And where can I obtain information on how employees should set up their DSE station? And also we got another question just asking if Stella Kane did have a DSE checklist.
Yes, we have a display screen equipment checklist that we can issue to our clients, also with information on how to set up the workstation as well, and with guidance and advice as well. So that can be issued on request. There's also some good information on the HSE's website regarding remote workers and display screen equipment use in these current times as well.
Yeah, brilliant. Just to reiterate, if you're a client, obviously you should have something uploaded to your members area already. If not, there are templates available on there, or you feel free to email a consultant. If you're not a client, if you email the admin at SKA Ltd email address that we mentioned at the start, we'll be able to give you a checklist through that email. So the last question, Chris, was: it's not practical for us to provide office chairs and desks to our employees who are now working from home. What should I do?
Okay. In normal circumstances for full-time home workers, like, I mean, I'm set up to work from home because I work from home once a day. You would be expected to provide desks, printers and proper screens and even docking stations. But as I said, it's uncertain times and we've had to react to a situation. So you've got to do what's practical. So as time goes on, you might need to look at sourcing more equipment. But there are practical ways at the moment. I mean, I've been doing a lot of work on my table downstairs because I get a better internet connection and we've got to do a lot of Zoom calls. So it might be just practical measures at the moment because you've got to do what's reasonably practicable. That's
it. I think it's a lot of it's thinking outside the box at this particular time, isn't it? I know
right.
I've got my laptop balanced on 2 jigsaws to make it the right height. So no, that's great, Chris. As mentioned earlier, guys, just a quick poll. So I've launched the poll now. Just some thought-provoking questions for you to based on Chris's presentation. I'll leave that up there for a few seconds. That's great. I can see a few of you are just voting on there now. So a couple more seconds, guys. That's brilliant. Thank you very much. Well, the poll is now finished. I'm going to hand over to Faye Bevington, who's going to be presenting mental health tips for staff working from home as well as staff on furlough. Thanks, Chris. Good afternoon, Faye.
Hi, are you okay?
Yeah, really good. How are you?
Good, thank you.
Good stuff.
Right, guys, so hopefully you can see my screen now. As Matt said, I'm Faye Bevington. I'm the training manager here at Stallard Kane. I've been with the business about 3 years, and my team are split currently between those working from home and those that have been furloughed. So what I'm here to talk to you today is about how we can look at creating a healthy work culture for your staff whilst they're working from home, and also whilst you've got obviously people on furlough. So as we're all acutely aware, in March 2020 we saw the government issue guidelines on how to work from home, if it was possible for you to work from home. And as Chris has mentioned, this was a huge shift very quickly for a lot of companies. So it's really important now, really more than ever, that we look at providing a healthy work culture, because it's quite easy now that people are working from home, those human connections are going to drop. People can feel isolated, and what we want to do is mitigate that as much as we can. So within this presentation, what I'm going to be looking at is offering you some practical solutions and guidance for yourselves and for the staff that you manage as well. Each slide is split into 4 sections. We're going to be looking at who's affected, what the actual issue is, why we need to address it, and how we can address it. Now, the thing to remember is the who is going to be consistent throughout. It's always going to be yourself and all of your staff. So the first thing we're going to be looking at is communication. Obviously, right now, we need to communicate with each other much more strongly than we have in the past, because we need to mitigate those feelings of isolation that could very easily slip in for our staff. As an employer, you have a duty of care to look after your staff's well-being. So in terms of communication, as Chris already mentioned, we're using different video conferencing software. We're having not just group team meetings, but we're also taking the time to have one-to-one meetings with our staff as well. Personally, with the staff that I manage, what I've done is we have a virtual coffee every day at 2:30. We sit down, we have about 10-15 minutes. We don't really talk about work issues. We're just being social, just interacting with each other. And that's inclusive of the staff that are also on furlough within my team as well, which is a really nice way for us all to stay in contact with each other. Another thing on here in terms of communication is, it's very easy at the moment to just be surrounded by negative information, whether that's through social media or your WhatsApp might be pinging because people are sending you memes. But actually, we need to look at sharing any positive stories as they come out. So within our business, one of our consultants' sons actually shaved his hair off for charity, raised a load of money. So we sent that out to all of our staff internally as a bit of a happy news story. But we also sent that out to all of our clients as well, just to give people a bit of break from the negativity. But I think in terms of communication, it's really important here to mention that actually how people will want to communicate can fluctuate from one week to the next, depending on what it is that they're actually going through at the time. So you may have somebody that one week is already caught up in homeschooling their children and actually doesn't have the time available to constantly be having kind of video conferencing calls with people. Whereas the next week they may have more time, they may feel more social. So you need to be flexible in your approach towards how you're communicating with your staff and just find the best method for them and for you. So routine is really important for everybody. All of our routines have changed. You've got people that would have had an hour's commute maybe into work, people that are now homeschooling, as I've mentioned. And if we're able to get a routine, it really does help people have a sense of control, which does reduce anxiety. So some things that we can look at, and my first point in there is encouraging your staff to get dressed. Now, this doesn't have to be in a dictatorial way at all, but actually getting dressed for work, even if you're working from home, kind of helps you define when it is you're working and when you're at home and relaxing. So the fact that you're using video conferencing and that you could be ringing your staff and seeing them face to face, that in itself should be enough encouragement to actually get people up and get people dressed. Creating a workplace, a workspace within your home can be really tricky for some people. So I'm very lucky. I had a small room available that I've easily been able to convert into an office. Not everybody has that luxury. I know some of my staff are working from bedrooms, kitchen tables, dining room tables, but I think in terms of the space that you create, it's really important to encourage your staff to pack down at the end of the day. Don't have piles of paperwork kind of sat on the kitchen table because they're constantly going to be looking at it. And that really does make it hard to differentiate between work and home if everything's always mixed together. It might be that as a company you look at providing storage boxes of some kind so that they can actually pack down everything at the end of the day and put it away. Defining hours of work. So although we want to be really flexible with our staff, actually you still need to define those hours. So I know for some members of Stallard Kane, what we've actually looked at doing is adjusting their hours around homeschooling. So, they may be looking at working from 6 o'clock in the morning till 9 o'clock in the morning, and then having the rest of the morning available to them to do homeschooling, and then the rest of the afternoon back to work. Now, obviously you have to manage that in terms of your business needs, but things like that, are a really good way to actually help your staff split their time at the moment. Another point I just want to mention is lunch breaks. If you have any staff that are covering your phone lines, it may be that actually they're not taking a lunch break. They're not kind of having that time where they can just detach for a little while because they're constantly with the phone. The phone might ring, there's anxiety around that. So it's about looking at actually, can you, over the lunch period, provide alternative cover for the phones? I know that's something that we've done as a business and it's worked really well. Finally on here, time management. You may have staff that have never had issues with time management at all, but actually the current situation, they're finding it really overwhelming. So they may struggle with workloads and deadlines. And as a manager, you really need to keep those lines of communication open with your staff so that you can give them any extra guidance as and when they need it. So all of your employees, including yourselves as managers, must be encouraged to look after your own well-being. Currently, we've got issues around social isolation, and then we've got routine changes can make people anxious, and then we've just got general worry, financial worries in some cases, about the impact of COVID-19. So what we need to do, as I mentioned before, is encourage a routine to distinguish between work and home life. If you're working in your home and you're not leaving your home anymore, those lines can become really blurred. So kind of setting out defined hours of work, encouraging people to get dressed because they need to be presentable for video conferencing is really, really important. As well, daily exercise is vital, but I'm going to come on to that in more detail on the next slide. So Chris mentioned that the HSE recommends getting up from your desk every hour for 5 minutes. Actually, there's a lot of information available for you to give to your staff on just exercises that they can actually carry out whilst they're sat at their desk and whilst they're working, just to keep blood flowing around their body, keep themselves limber. So if you are sending out a weekly bulletin to your staff, which we're doing, it might be a good idea to include some of that information on there so that they can actually go off and see what is available to them. Allow flexibility, as I've already mentioned, that's really, really important right now. People are torn between doing their work and homeschooling, so looking after dependents, there's got to be a balance that everybody can come to. Healthy eating, again, is really important, but that will be covered more in a second. And communication, allow people and push people to communicate with each other. So my team that have been furloughed, I'm in contact with them every day, but actually they may not necessarily speak to anybody else outside of our team. So it would be really nice for you as a company to kind of make those decisions about who stays in contact with people. Is that going to change week in, week out, so that they have different conversations with different people? I think it's just really important, like I say, to really encourage people to communicate, speak to friends, speak to colleagues as much as possible. So healthy habits are something that take months, years to build in some cases, but can be broken so quickly, and negative habits can easily take their place. So you've all got staff now that are working from home. People can become inactive and unfit very quickly. You may have people in your business that were gym goers or members of running clubs, or would go to aerobics classes a couple of times a week, and now these people have had all of that taken away from them. So it's really important that you find ways to encourage physical activity and healthy eating, as there are so many links between that improving your mental health, as well as obviously maintaining a healthy weight. So what you can look at doing is encourage employees to participate in online exercises. Personally, what I've done with my team is we have set ourselves a virtual walking challenge. So in May, we have set ourselves that we are walking the Inca Trail. So the Inca Trail is a certain amount of kilometres long. We've divided it up by each of us. Each of us has to walk a certain percentage of that. And then at the end of the month, we would have cumulatively walked the Inca Trail. Now, in setting this, and obviously getting everybody as a team to work together, and a lot of camaraderie came from this, what we actually realised was that 2 of my team have very young children and were not able to kind of go out and go on these long walks. So what we did was I asked everybody what it was that they would fancy doing instead, and we came up with a squat challenge. So it's about, if you're setting these virtual activities or tasks that we could all join in, actually maybe tailoring it to the needs of the people within your team or within your business. I think it's really important. It's worked really well for all of us. We're all, you know, messaging each other and texting each other and encouraging each other to do it. Now, obviously, one of the activities we chose was walking. Now, there are so many benefits of just being outside in general. It boosts your energy, it forces you to have time away from your screen, whether that's a laptop or whether that's your phone, you're just not looking at it. You're in natural light, it encourages vitamin D production, and it just increases your concentration when you're back in the workplace. So I can't stress enough, you know, follow the government guidelines, but really do encourage your staff to take those daily walks. Healthy eating is really important right now. So like I say, if you're sending out information and e-bulletins and things like that to your staff, you could want to create maybe a online recipe book, for example, that your staff could upload different recipe ideas to that are healthy, ways to get their families involved, kind of structuring meals and meal times. It's really important that you allow your staff kind of that, again, that flexibility, but yet rigidity, that they can say every day, this is when I'm going to have breakfast, lunch and dinner, because what you want to maintain is a kind of a set blood sugar level. When your levels start to drop during the day because you've gone too long between meals, that's when you want the quick fix. You're grabbing for the snacks, which are often sugar-based, and obviously that just doesn't do anything for people's physical health long term. I just wanted to briefly touch on alcohol, this obviously can be used as a coping mechanism for stress and anxiety by lots of people. However, alcohol can lead to a lowered immune system, and it can make you have a lower mood. So if you are sending out this information to your colleagues, to your staff, put in there about other potential ways that you can look at managing stress and anxiety. You might want to mention meditation or hobbies. One of my friends, they've actually started a virtual book group with some people at their work. So there's lots of things that you can do. Finally on here, I think it's important to encourage your staff to search for information from reliable sources. So your staff need to feel confident that you're going to provide them with anything that they need to know that's vital. But likewise, you know, if people sit and they scroll in on social media, or, you know, they open up an internet browser, there's so much information straight away about the current situation, it's really hard to avoid it. So actually just kind of saying to people, you know, if you're looking for further information that we haven't yet provided, you know, go on the World Health Organization, go on the gov.uk website, you know, don't look for your information from social media platforms. I just want to briefly touch on financial resilience. It's very easy for people during really stressful times to bury their head in the sand. We've all done it, I'm sure. So it's really important at this point to let staff know where they can go to get further information on finances, because it may be that actually you have staff that do need additional guidance right now. There are so many studies that kind of show the correlation between mental health and well-being issues and financial stresses that are going on. So you want to encourage your employees to be able to have those open and honest conversations with you as their employer. And it might not be that you're able to do anything other than signpost them, whether that's to the government website, whether that's, you know, making sure people realise they can talk to their bank, they can talk to loan providers, energy companies. There's a lot of help out there, so just make them aware that you know what it is. And again, if you're communicating out with them, put that information on there anyway, so then they don't have to go searching for it, it's straight there. This slide is slightly different to the others. This is just a few points that I wanted to talk around. In regards to HR, they're able to provide support for managers within your business. So they'll be able to look at reviewing support services available. So it's really important, obviously, if you use our HR services, or if you have somebody internally that looks after that, you know, use that as a resource. Review your employee assistance program if you have one. So what Stallard Kane had was a provision whereby we could have face-to-face counselling. Actually, that's obviously now not available. So they've switched to video conferencing, which is great. But actually make sure that your provision is fit for purpose and promote this to all of your staff as well. It's no good having it if nobody knows that it's there. So we have what's called a Wobot app. And this app basically uses artificial intelligence to track your mood, it tracks your exercise patterns, and it's all done via messaging, so you don't actually have to talk to anybody. It's ideal for staff who may not really want to express how they're feeling and kind of want to do things like in private, really, without, like I say, vocalizing what's going on. But the app actually uses cognitive behavioral therapy techniques. So if you have a current situation that you're not able to deal with, it asks you a series of questions and gives you tools to be able to deal with that situation. So it's something that we use here, and it's really great. I'm one of the mental health first aiders here at Stallard Kane, and it's really important that your staff are aware that if you have got mental health first aiders, they are still available to talk to people, to help. But you know, when you're sending your mental health first aiders home, there might not have been time to get them set up with a webcam and things like this. It's really important that if you've got them, you need to allow them to have as much provision to be able to still provide the same service. So think about, you know, getting the webcam, making sure they've got a microphone, they can speak to people, and again, promoting this regularly to all of the staff within your business. Signposting, I think, is one of the most important things, and this is usually best placed with your mental health first aiders. they can encourage your employees that go to them to actually reach out to different support networks that will be available. Lots of these are local, there's lots of Facebook support groups out there at the moment, and there's lots of national ones as well. So there's a lot of information that your mental health first aiders will be able to give out to your staff if they need it. In regards to family, it's really important that we allow our staff that time to kind of have the time during the day to spend with their family or any dependents. As Chris mentioned, you know, we've all got different things that are going on, as well as having, you know, full-time jobs around it. So it's a bit of a juggling act. So we do need to be as flexible as we can. You know, some people are going to have no social interaction of any kind. You know, if you've got staff that are living by themselves, these will be the first people that are going to get affected by feeling isolated. So they're not going to have that family around them. So their needs are going to be completely different from those that have a busy household and a busy family around them. So I think it's really important to kind of, again, because you're communicating with your staff, really keep an eye on how people may be struggling and feeling with different things. Encourage your staff to use the video conferencing platforms that they use for work to interact with their family and friends. You know, my friends, we do regular quizzes using Zoom. My parents, we have breakfast together on a Saturday morning using Zoom. So it's really nice as well to have that structure in, because you can build a routine. And again, that gives people that feeling of control, which they're really missing at the moment. So just some takeaway points from this. I think it's really, really important to stay in contact with your staff, especially those who are on furlough. It's so easy as a manager to just be concentrating on the staff that are ticking everything over and are in the business and everything's really busy and, you know, we're all really stretched. But actually those staff are on furlough, they're still a really big and important part of your team. So it's your responsibility as a manager to make sure they're still in regular contact with the business and with individuals within the business as well. It doesn't always have to be the same person that they're talking to. Be as flexible with staff as work will allow, whilst encouraging them to still have that routine. Use video to stay in contact. Don't always rely on written forms of communication. Don't text, don't email. I mean, it has its place, but do take the time to, you know, have a video conference with somebody. Encourage those healthy habits in your staff and ensure that you've got signposting to other services should people need it. So that's everything from me. Thank you for listening. Matt, have we got any questions?
Yeah, thanks, Faye. That was really, really interesting. Some great tips there. We have got a couple of questions. The first one is, how do I speak to staff who may have mental health issues that are being triggered by the current situation?
Okay, so for me, the most important thing about speaking with staff on this topic is being just direct about it. There's no point kind of going around the houses. If there's an issue, it does need discussing. Speak to the staff as well about what networks, what support networks they usually have, and encourage them to use that where possible. Where that's not possible, look at alternatives for them. But I think the main thing is ask the person what it is that they need. Quite often, people will already have an idea in their heads about what's going to help them. So just asking that question can set that conversation going. Yeah,
definitely. The next question is, how can I make furloughed staff still feel part of the team?
Okay, so for me, it's like I said earlier, you know, it's about deciding who is going to contact these staff. Is it going to be that line manager? Is it going to be the mental health first aider? Is it going to be somebody in HR? Is it going to be a mixture of people? So I think that's the first thing as a business. You just need to make that decision first. And then, you know, whether you're ringing them or video calling them, like I say, with my furlough staff, they're all in the coffee afternoon that we have at 2:30. That works really well because it allows everybody to have a good catch up with each other and nobody's really feeling left out. So that's how I'm looking at doing it with my team.
Yeah, I think we're the same as well in our team, that the weekly catch-ups have been really important for everyone, I think. And the virtual coffee mornings are a brilliant idea. I think that helps keep that routine that you touched on. Because there's a social aspect of obviously being in and around the office, having a brew, having a catch up with guys, maybe not even work related stuff.
Absolutely, that's it. And I think that's what we've been missing is, you know, when we are having these calls, it tends to just be all work related, and actually we've kind of lost all of the energy and the relationships, the smaller relationships that come from being in an office. So having those virtual coffee mornings, I found, has kind of injected that back in.
Definitely. On the other side, there are a couple of employees in our team that want to be kept up to date with work-related matters. So, keeping them in the email chains with just general news of what's going on. So, yeah, brilliant, Faith. Thank you very much. The last question was, is it the company's responsibility to manage home life and personal stress, which isn't work-related?
And that's actually really interesting. So if you've got somebody that's diagnosed with a mental health condition that works for you, under the Equality Act 2010, you have a duty as their employer to help manage their condition fairly. Now, this applies even if actually people haven't got a diagnosis. So the things that you're looking at doing is everything that I've discussed already. It's discussing any issues in a direct manner, exploring support available, discussing the job role. There may be a certain aspect within that job that's causing them stress and anxiety that maybe you can just take away. And also looking at reasonable adjustments. And, it doesn't matter if the stresses, the triggers aren't actually associated with work. You still have that duty of care there to be able to look at other ways to help that member of staff.
Brilliant, Faye. And just one more really quick one has just come in now as I'm looking at the questions. What training is required to become a mental health first aider?
So the mental health first aid course is a 2-day course. I personally highly recommend it. Obviously, I've sat on the course myself. And what I would say is it's really important within your business to have at least a minimum of 2 mental health first aiders, because if everybody in your business is only going to one person, that one person then doesn't have anywhere else to go, because it can be quite overwhelming, some of the content that people talk to you about. So it's a 2-day course. We can give you more details on that, but I would always recommend 2 as a minimum.
Brilliant. Thank you very much, Faye. As mentioned, we're just going to run a quick poll. That poll is now live. Give you guys a few seconds just to answer those questions, and then we will move on to Sue with travel, welfare and PPE. Brilliant. I can see a few answers coming in now, guys. So a few more seconds. Excellent stuff. I've just handed that now. So thank you for that, Faye.
Thank you.
Sue, I'm going to hand over to yourself now.
Good afternoon, Matt.
Afternoon. How are you?
Fine, thank you.
Good stuff.
So let's get this shared.
Excellent.
Has
Perfect.
that come up? Okay, good afternoon, everybody. Thanks for the introduction, Matt. Hope you're all well. My name's Sue. I've been with Stallard Kane now for about 9 months, the health and safety advisor, although I have been in the health and safety business for about 9 years. I currently have clients based from as far up as in Scotland right down to Brighton, so on a weekly basis I do travel to most places of the UK. I was asked today to put a segment together for this webinar based on the workplace, travel and PPE. So if we look, as we know, in March 2020, the government implemented measures after assessing the COVID-19 situation to control and limit the spread of the virus and to protect the workforce. With businesses now starting to reopen and go back into business and start trading again, this is now becoming more important. These measures are in place for businesses where closure or home working is not possible. Mainly at the moment it's covering construction, manufacturing and essentially those that are delivering frontline services. So during this part of the webinar, we're going to be looking further at travelling to the place of work, your workplace arrangements, welfare, toilet facilities and PPE and cleaning supplies. Okay, so the first thing, before travelling to work, I mean, one of the things that employees should be really looking at is, are they fit to come to work today? So have they themselves been showing any symptoms of COVID-19? Have they got a cough, high temperature with a fever? And also, have they been in contact with anybody who's infected or showing signs? Do they live with somebody or have they been in close contact with somebody? If this is a yes in either of these cases, then they should be deemed as not fit for work, and they need to be staying at home and self-isolating. Another thing during this time, with all the emphasis being put on the COVID-19, it gets distracted away from what's normal. So have they got access to the necessary PPE that they normally need? I mean, this could be boots, high-vis, gloves, but any extra PPE that they're going to need if they are coming onto site or into the workplace. And also they should have easy access to hand gel and tissues. Travelling to work. One of the most common ways for getting to work, especially in the construction industry, is vans who on the way to work will pick multiple people up. So you could end up with 5 or 6 people in one van. This essentially at the minute should be stopped. So we should advise really one person to either in a car or one person to a van. I mean, the best scenario really is for everybody to travel to and from work in their own transport. If this is not possible and people are car sharing, we would advise that you only share with one person and you share with the same person all the time. So even if that means that that person only, comes to work with you 3 days a week, don't pick somebody else up for the other 2 days, just travel on your own. Where sharing cars and vans is being used as a regular occurrence, they should be subjected to a thorough clean. It should be done at least weekly or more frequently, especially if you're using your own private car. You're picking other people up and transporting them to work and then home at the end of the day. But then you're then going on to use that vehicle or car for taking your family members, children somewhere. It needs to be clean between these uses. You can use standard cleaning products, a pair of gloves, but pay particular attention to where whoever's been in the car might have touched. So you've got your handles, your dashboard. In certain instances, classical example, I've got a friend that whenever she gets in my car, we travel together a lot of places, she'll come straight in, she turns the radio down, and then she'll go in the glove compartment to see what sweets and things are in there. So ideally, she's touching everything that then my partner or my child might get in and touch when they get in. So these need to be clean between every person that's in the car. Hand gel is another important thing. So if you are traveling with somebody, or if you have got somebody traveling in your car, make sure you've got access to hand gel. So always use the hand gel when you get to where you're going, you get out, shut the door, and then use the hand gel. When it comes to public transport, we would recommend that you don't use this unless it's absolutely necessary. If you do have to use public transport, make sure you remember the 2 metre distancing rule and sit as far away from other passengers, whether it be on the bus or the train, as possible. Again, remembering to use the hand gel. So once you've got onto the transport, sat down, use the hand gel. Again, once you've got off, have exited the vehicle or whatever, again, use the hand gel thoroughly and work on. Okay, when it comes to our workplace, a risk assessment is one of the essential things that we should be carrying out in light of the COVID-19. It's one of the vital tools that we use as businesses to justify our decisions and actions. And it basically needs to be carried out and available for all your employees to read and sign before recommencing work. So they need to be made and drawn to the highlighted control measures that have been put in place and any extra PPE that they're going to need for their work task or their areas where they depend to work. One of the things you should be looking at is, do you understand the biology of this virus and how it can be transmitted or spread? And have you identified any activities or location where the likelihood of transmission is increased? So then, have you applied the hierarchy of risk control to develop your control strategy? And does your risk control strategy highlight any areas of increased contamination? So if we work our way down that, elimination, socialisation, this must be used as a first choice wherever it's possible to be done. Unfortunately, this can't be done in every instance, and this is why we apply these control measures for employees to come back. Substitution, this doesn't apply when you're accessing the virus. When we're looking at engineering controls, ventilation is one of the main ones. So ensure that You keep windows, doors open wherever possible to allow fresh air to circulate throughout on a daily basis. It might be that you've got roller doors or warehouse doors. Where possible, keep them propped open and allow the air to flow through on a daily basis. You can also use physical barriers to eliminate face-to-face contact. Administrative controls, again, work from home wherever possible. Have a staged return of staff, so don't bring everybody back all in one go. Bring back one shift at a time. Try breaking your teams down into smaller numbers. If it's possible, make office spaces more spread out, move desks. If you are breaking teams down into smaller numbers and bringing them back at a stage return, keep teams with the same people, don't swap members about. Whatever you have in a morning, stick to them every morning, don't switch members about. Limit the numbers in office and wherever possible, amend work schedules. RPE and PPE, this should always be your last resort of controls and when used when all the other ones have been addressed. So this is when you're looking at respirators, gloves and masks, for instance. When you're looking at what workplace arrangements you've got in place, before any employees return to work, or this should be done periodically if you're still working been throughout, employees should be completing a screening questionnaire themselves. This will give you some more up-to-date information of any exposure they've had, whether they've had it while they've been home working for 6 weeks, but they've gone past the isolation period and they're now allowed to come back. This will give you the information that you then need should anything arise at a later date. You'll also need to put a procedure in place to what will happen in the event of an employee becoming ill while they're at work, such as how have they travelled to work, who have they been in contact with while they've been at work. So these issues will all need to be addressed and a procedure is the best place of doing this. Throughout your site, use adequate warning signs. This will keep raised awareness around. So use your 2 metre social distancing signs, signs that encourage people not to touch things unless they really need to, and stop signs where there's areas where it's just best that they don't go. Another thing is always keep your employees updated on what is happening and why. Explain to them that you're doing this for their benefit. Some people don't adapt very well to sudden change, and these are the ones that like to be kept updated of what you're doing and why. Give them clear instructions on what you're expecting them to do. And where possible, give them up-to-date information. If you're having staff meetings, include staff representatives off the shop floor, whether it be a health and safety representative you've got, or just a HR representative you've got. Include them in on meetings where you're discussing ongoing changes so they can then feed it back to the workforce. Control access to your workplace is another big thing. Fingerprint scanners are one of the main uses in big factories where you've got hundreds of people coming in and out on a daily basis. An alternative method should be used for the foreseeable future if possible. If not, then cleaning provisions should be provided for this. This might be putting a table next to the scanners with an antiviral spray and wipes so that between each person clocking in or clocking out, it can be wiped down before the next person comes to use. Door handles and latches, these should also be subjected to more frequent cleaning during the day, especially at busier times of day. So if you've got people routinely walking in and out of certain doors, give them an extra cleaning schedule on top of everything else. And remember that the 2 metre social distancing rule should be maintained when entering and exiting the site at the beginning and end of a shift. This may mean that at the beginning of every shift, you may need to allow extra time because obviously normal routines of everybody just continually coming in between each other is going to be slowed down quite a lot. Barriers should be used to ensure social distancing and plastic screens you to avoid physical contact. This could be where you've got a front of house receptionist sat there and does have visitors coming in and out on a daily basis. Another way of doing this is to either reduce or temporarily stop altogether any unnecessary visitors to site. If they don't really need to be on there, don't have them on there. Another thing, if you have got visitors coming in, and again, they would normally use a control pad or sign in at a visitor book, get the receptionist to do this. Or if you've got security guards on the gate, get them to log all visitor entrances and times. So again, this takes away the necessary need for them to touch any control panels or signing in procedures. When it comes out to carrying out their daily job, the best thing you can do wherever possible is to reduce the numbers of employees that you have on site. This could be achieved by either implementing a shift system. If you normally work a 9 to 5, this could be reduced down to a 6 to 2 and a 2 to 10, or maybe installing a temporary night shift. So you could have a day shift and a night shift. Now, not all businesses will give the allowance for this to be done, but wherever possible, it should try and be implemented. Other areas where you can look at doing it is desk moves, smaller teams. Again, same as we said before, keep the same members in teams all the time, don't change them about. Nitrile gloves should be made available for production lines to eliminate skin-to-skin contact. This is essential on lines where you've got production and you've got the same component that has been touched by numerous employees as it's passed down the line. Again, antiviral sprays and wipes should be issued and available for cleaning down machinery and parts between use and touch. When it comes to welfare and canteen facilities, again, you need to reduce the numbers and contact at all times in there. So by staggering break times, that will reduce the number of people in the canteen at a time. So it could be done over a 2 or 3 hour period. Again, hand gel should be available. So make it available for use for everybody on going into the canteen. And again, once they've finished and coming out. It may be that you space your tables and chairs out if your canteen will allow that. If not, remove every other chair from out of the table. This will ensure that people are not sat opposite each other and that they are sat 2 meters apart. Again, provide antiviral sprays and paper towels to wipe down microwaves, kettles, fridges, etc. if they're there for communal use. And encourage them to do it after individuals to do it, after they've used the kettle or the microwave. Ensure waste towels are disposed of in a closed lid bin, and then this should be treated as clinical waste. Keep it separate from food waste all the time. You do have some instances, like we do at work when we're in the office, some of us prefer to sit and have our dinner at a desk. If you're doing something particular and you're using your laptop or whatever for your own purposes during dinner, make sure that you only fetch drinks and trays and plates for yourself. More often than not, when we're in the office, if we go make a drink, we'll make a drink for probably 4 or 5 others at the time as well. For the time being, this should stop. Just do your own thing. And again, once you've finished, clear your own things away. Don't do it for everybody else. This goes for clearing your desk down at the end of the day. Put your own pens, paper, anything else that can be put away out of the way so it's not used by another member of staff. Toilet facilities. Some places only have a small facilities, which maybe just have a couple of toilets and 1 sink. If this is the case, then these should be used in a 1 in, 1 out basis. You can put a simple sign on the outside of the door to stay in use and make sure you've got essential cleaning products in there. If you have got larger toilet facilities, so you've got numerous cubicles, urinals and sinks, then take every other one out of use so that you can maybe have 3 or 4 people in there using the facilities, but they're going to be subjected to the social distancing while they're in there. Another thing, display signs to encourage the correct 20-second hand washing procedure in and around the facilities to make sure people are taking note of how to clean their hands and doing it properly. More frequent and thorough cleaning should be done by a cleaning team throughout the day. Most places will probably do a clean first thing in the morning and a clean first thing in the afternoon. These should be subjected to maybe an additional 2 or 3 times cleaning during a day, and especially going back to the canteen facilities as well. These should be done between each sit-in and tables and chairs wiped between each person that's sat at them. Again, hand gels should be available for use on leaving toilet facilities. Cleaning procedures throughout the whole of the workplace. There should be an increased cleaning frequency by an in-house cleaning team wherever possible. Some companies do use contract cleaners, but this is bringing extra visitors into the site, which you're trying to discourage at this time. Again, allow good ventilation throughout the place, so keep windows and doors open where possible to allow the air to flow through. Make sure there's adequate cleaning cloths and paper towels about for people to use if they're using extras to what the normal amount is. An additional cleaning regime in and around the workplace may mean that on a daily cleaning regime, this is cleaning extra areas which would normally be part of a weekly clean, such as banister rails, office equipment like monitors, keyboards, telephones. These might not be done on a daily basis, but they should be done at least once thoroughly daily now, if not twice. And these should be done and sanitized to a high standard. Another thing that you must remember is when you're sourcing your cleaning products, you need to be looking for antiviral products, as COVID-19 has been highlighted as a viral infection. It's not bacterial. Looking at PPE. Okay, so as we've found out through the information that we've been given, the best defense against the spread of COVID is the regular and thorough washing and sanitizing of your hands, as this breaks the cycle of contamination. So PPE should be readily available. Nitrile gloves, as we discussed, should be made for eliminating skin-to-skin contact and readily available on production lines where you've got numerous people who are coming into contact with the same part. Masks. If people are using FFP3 masks as part of their daily tasks, this doesn't need to change. They can carry on using the same. Some industries and workplaces use a face shield. So it should be noted, if there is any places where face shields are used and this area has been highlighted as it might have an increased risk of contamination, then the face shield should be substituted, in this case, for a respirator. Any PPE, this should be cleaned and stored away properly between each use, but it shouldn't be shared between users. If it's used once by one person, at the end of the day, it should be thoroughly cleaned, sanitized, stored away correctly for the next day. Single-use PPE. Once this has been finished with, whether it be the end of the shift or whether the end of the working day, it should be disposed of straight away. It's all too easy to think if you're coming back to the same workstation tomorrow, there's going to be nobody else there in the meantime, but somebody else might come in the next day and pick your mask up by mistake and put it on. This should be disposed of the minute it's taken off and treated as clinical waste to avoid it being used by somebody else. Hand washing and hand gels. Okay, so where possible, hand washing for the recommended 20 seconds should be encouraged. The World Health Organization have a demonstration of the correct hand washing method, which is in a short clip video. This is available for you to view and you can download it on YouTube. In areas where hand washing is not practical or not available, then hand gel should be readily available. It's recommended that 70% alcohol-based gel is used as the recommended hand sanitizer, but where this is not available, 60% alcohol-based will offer some protection. Again, as we said on the last with cleaning, it's an antiviral that should be sourced, not antibacterial. Okay, so if we look at the legalities around COVID-19, as we know under the Health and Safety at Work Act 1974, all employees have a legal duty to provide adequate welfare facilities. So this includes employers having a legal duty to provide a safe working environment for their staff, which at the minute is extremely important. We now know that COVID-19, which has been shown to have a potential link back to the workplace, is now reportable under REDAR. And the HSE has now confirmed that it will be taking action against companies that are not following the current government guidelines and who are putting their workforce at considerable risk. So if we just summarise some of the points we've just gone through, your workers must be fit to attend the workplace and travel to and from using the safe available option to them. Stallard Kane can issue you with a back to work pack to assist you with returning employees. Monitor and control entry and exit to the workplace and use the safest and easiest method where possible. And implement suitable and sufficient controls to maintain social distancing on site and safety during working hours. Provide adequate measures for welfare, canteen and toilet facilities, whatever works out the best for your company. And maintain a thorough and regular cleaning regime to a high standard at all times. But most importantly, during this time, if you're just reopening your business or if you've been operating throughout, you must adhere to the government guidelines at all times. Okay, thank you for that. I hope you found some interesting tips in there. Before we move on to the job retention scheme, have we got any questions, Matt?
Yeah, thank you, Sue. Really informative and very relevant. Obviously, that's going to become more and more relevant as the weeks go on, as more people return to work. So definitely worth taking some notes with that presentation. We've got plenty of questions with this one, guys. So just to reiterate, I've only managed to select a couple that we can ask Sue just because of time. Any that don't get answered, either by our panelists or by Sue live or the other presenters, will be addressed and made available on our website. So the first question, Sue, what should we do with employees who turn up to work and develop symptoms? Okay,
so as we said before, putting together a procedure for what this would happen, but this should include advising the infected person or the one showing the symptoms to leave site and advise them to call NHS 111. So anybody who's been in contact with them, now this could be anybody who they've been working with, who they've travelled to work with, effectively they should leave site as well, and they should self-isolate for 7 days. If they've travelled to work on public transport, it's fine for them to go home on public transport as long as they stick to the 2 metre socialising distance. You can advise them to cover the face. Now, although this hasn't been a government requirement, it's something that you could advise them to do. Just give them a face shield, just so they can cover the face against anything. Again, it may be RID or reportable, but again, if there's any queries regarding this or whether it would come under those restraints or not, you could get advice from any health and safety consultants on that.
Brilliant. Yeah, definitely worth reiterating the RID or point. Obviously, it's brand new to everybody,
yeah,
these
definitely.
particular reportable illnesses and dangerous occurrences. So yeah, please feel free to get in touch with your consultant or the admin email address if you've got any questions on that one. The next one, Sue, how often should we be carrying out extra cleaning and who should do it?
Okay, so basic cleaning should be done by the individuals. If you've been using kettles, microwaves, if you've been using something like a drinks machine or a vending machine, cleaning products should be available next to those facilities to give the individual the opportunity to spray it and wipe it once they're finished with it, ready for the next user. When it comes to cleaning teams, wherever possible, we would encourage you use in-house cleaning teams to avoid extra visitors with contractors coming on site. But definitely a deep clean should be done at least once a day, if not more frequently.
Great stuff. Thank you, Sue. And the last one was regarding face fit testing. So do we need to face fit test all mask users and how do we carry out the test and maintain social distancing? Okay,
so all loose fitting RPE must be face fit tested to ensure a proper fit and the person must be clean shaven. Now at the moment it's impossible to carry out using some of the normal methods, taking into account the social distancing. We've been advised, and it's available on the HSE website, that the best way of doing that at the moment is verbal instruction. If you do have somebody who's trained in face fit testing, then they can demonstrate this to users. And there are posters available on the HSE website that you can download and print off. Now these could be put in cloakrooms or wherever the person would come in a morning, probably first to fit the RPE, and put it in there with a mirror so they can follow the instructions on how to get the best fit through it, but at the same time it's easier if they're looking at a mirror when done that. But you can have somebody in there verbally instructing them, you know, to give them a general idea of how it should be fitted. But we wouldn't recommend using any of the other methods to this time because you can't ensure the 2 metre distancing rule.
Okay, great stuff. Thank you, Sue. Definitely worth looking at HC website on that, because the posters, like Sue touched on, are very useful. So once again, guys, let me just put up the latest poll. Give you a few seconds to answer that. Just touching on some of the points that Sue's covered in her presentation, making you do a bit of thinking about your current situation and whether there's anything else that can be done either by yourselves or whether you need to ask any more assistance of Stallard Kane. So a few more seconds, guys. I can see plenty of you have answered them, so that's brilliant. So good stuff. That's now finished, and thank you very much, Sue. I'm going to hand over now to Claudia for the Coronavirus Job Retention Scheme. Afternoon, Claudia.
Hi, Matt. You okay?
Yes, very good. Thank you.
Good. Okay, hi everybody. My name's Claudia and I am here representing our HR team today. The topic that I've been asked to cover is the Coronavirus Job Retention Scheme, or many of you might actually be referring to this as the furlough scheme. I'm very aware that those of you who are already in receipt of our HR services most likely will already have spoken to your advisor about the scheme and what it means for your organisation. However, there might be a lot of people watching who are not in receipt of our HR services, so they will benefit from a good overview of what the scheme is. And also, since the scheme was very first launched, the government have continuously been updating the guidance. So I think it's really beneficial for everybody to have a good overview of the scheme and where it is currently. So if I start off by just explaining exactly what the scheme is. Obviously, since the outbreak of the coronavirus, I'd say the majority of businesses have been affected in some way. You may have seen a significant downturn in work, or many of you may have chosen to temporarily close your doors, or you may have been forced to actually temporarily close a business. The first question that comes to mind when that happens is, what about my staff? What are they entitled to? What should I be paying them? How do I go about placing them on leave? So this scheme is the government's answer to all of those questions. So the scheme is available to any UK business whose operations have been severely affected by COVID-19. So when we're talking about a UK business, to qualify, you must have a UK bank account and also a PAYE payroll system. So if that's you and you've been affected, under this scheme, you can place your staff on furlough. Now, I'm sure we've all heard that word a lot in the last few weeks, but it's maybe not something we had heard before that. It is actually an American term, and basically what furlough means is you are placing your staff on a period of temporary leave. By doing that, by placing your employees on furlough, you can then claim a grant from the government to cover 80% of their usual monthly wage costs. That is up to a cap of £2,500 per employee per month, and you can also claim the associated level of national insurance and pension contributions as well. So currently the scheme's open for a period of 4 months. It was originally launched mid-March, and the government did backdate the scheme to start from the 1st of March 2020. It's currently set to run until the very end of June. It has already been extended once, so when it was originally launched, it was just open until the end of May. So really important for everybody to note that it is now open until the 30th of June 2020. And finally, there is a minimum furlough period of 3 weeks. So if you do decide to furlough your staff and look to claim this grant, your staff have to be placed on furlough for 3 consecutive weeks. If you bring them back sooner, you will not be eligible to claim the 80% grant. So make sure it's for 3 consecutive weeks at any one time. So I'm now just going to run through who is eligible to be furloughed. So which of your employees can be furloughed and who cannot be furloughed. So starting with who can be furloughed. Any employee who is on your payroll on or before the 19th of March 2020 can be furloughed. When we say on your payroll, that means that they had to have been paid by the 19th of March and HMRC had to have been notified of that person via an RTI submission on or before the 19th of March. That date is really, really important because when the scheme was first launched, the cut-off date was the 28th of February. So that has now been extended to the 19th of March. However, the 28th of February is still an important date. So if you have any employee who stopped working for you or who was made redundant after the 28th of February, you can now choose to re-employ those people and place them on furlough. And also, if you have any staff who were placed on unpaid leave after the 28th of February, you can now furlough them instead. So I know that a lot of businesses were originally looking at temporary layoff or periods of unpaid leave. You can use furlough as the alternative now. Moving across to the 3 bullet points on the right-hand side. Before I go into these, I will just say that when the scheme was very first launched, its intention was to protect anybody whose job would otherwise be at risk of redundancy. Since then, the government have updated the guidance and it's been extended to cover a broader range of people. So the first bullet point here is that it now covers anyone who has been advised to shield in line with public health guidance. So what I mean by that is that there are many people across the UK who will have received a letter from either their GP or the NHS advising them that because of a pre-existing health condition, they are at increased risk if they were to contract coronavirus. Because of that, these people need to stay home for a period of 12 weeks. So if you have any employee that's received one of those letters, you can place them on furlough. And also, if you've got any employee who lives in the same household as someone who is shielding, they can be furloughed as well. And the scheme also now covers those who have got caring responsibilities. Obviously, the schools are currently closed. There are going to be a lot of parents up and down the country who, because of childcare commitments, are no longer available to work. If that's the case, you can opt to furlough those employees. And finally, there is also a list of other non-employees who are eligible to be furloughed. I'll quickly run through those for you now. So non-employees that can be furloughed includes office holders, company directors, salaried members of limited liability partnerships, agency workers, and Limb B workers. One area that I've not covered on this slide or at all throughout the presentation is the public sector. When looking at public sector organisations, the majority of them are funded by the government anyway. So if you are a public sector organisation and the government already provide you with funding to cover your staff costs, it's expected that you will not be placing your employees on furlough. You will not be eligible. However, there are a very small number of public organisations who are not primarily funded by the government, in which case you may be able to furlough some of your staff. But I would strongly encourage that you seek advice before doing that, just to make sure you are eligible. But finally, looking at the public sector, if there are any contingent workers in the public sector, they can be furloughed. And finally, if there are any contractors working in the public sector who fall under the scope of the IR35 rules, they potentially can be furloughed as well. So that's a quick run through of who can be furloughed, who cannot be furloughed. 2 bullet points on the left-hand side. Anybody who is working on reduced pay or anyone who is working reduced hours, they cannot be furloughed under this scheme. Anyone who's placed on furlough should not be undertaking any form of work that would provide a service or generate revenue for the business. So if you have still got people at work, albeit on reduced hours or on a reduced salary that they've agreed to, they cannot be furloughed as well. It's one or the other. And finally, on the right-hand side, this point only applies to those businesses that are still in operation. So if you are still open and you've got people coming to work, if somebody then goes off on short-term sickness absence, the usual sick pay rules apply. Just because they've gone off poorly for a few days does not mean that they should automatically be furloughed. And the guidance specifically says that the scheme is not intended to cover short-term absence. I have popped on the end there, unless for a business reason. The reason I've said that is because you might have somebody go off sick for a few days, and within those few days, you actually then make the decision to furlough a group of employees or to furlough everybody. If that was the case, then that individual could be considered for furlough. So that covers the scheme and who's entitled to be furloughed, but how do you actually go about doing this? I've put on this slide, there's an argument around notification versus agreement. So when this scheme was originally launched in March, the government guidance simply said that to place your staff on furlough, the employer simply needs to notify the employee of their intention to do that. There was also an assumption made that if you had a temporary layoff clause in your contract, you potentially had the right to enforce a period of furlough regardless. So many people simply wrote to their staff and said, this is what we're looking to do. You're going to be placed on furlough for X amount of time. Since then, it was some weeks later that the government guidance changed, and they have now advised that all employers should be seeking staff's express agreement to being placed on furlough. As a result of that, we are now recommending that employers should be writing to their staff to not only explain what the furlough scheme is and what the business are looking to do, but also to seek their agreement to being placed on furlough. So that can all be done in one letter. And what I would do is ask staff to sign and return that letter, or alternatively, you could ask them to drop their manager an email to confirm they're in agreement of being placed on furlough. Once you have their agreement, you should be keeping a record of that on file for the next 5 years. That's what the guidance says, and that suggests to us that HMRC are going to be auditing the use of this scheme for the next 5 years. So really important to make sure that your records are up to date. So finally, before I move back to Matt to run through some frequently asked questions, because I know that we're getting a lot of questions on this area, I just wanted to briefly run through how you go about making a claim. So once you've placed everybody on furlough, you will then claim the grant through the HMRC online portal. Now, to start with, we've had a lot of questions from our clients about how to calculate the 80% of wages, what should be included as part of regular wage costs and what should not be included. I just want to make everybody aware that there is now a calculator on the government website that you can use to help you calculate the 80% wage costs. So I would point you in the direction of that calculator first. Lots of people have found that really useful. And that calculator now sits alongside a full government guidance page. It's really, really good information. It covers lots of different types of contracts, lots of different circumstances, and tells you how you should be calculating the 80%, you know, depending on what your individual circumstances are. So I would point you in the direction of that first. Once you've got all your figures together and you're ready to submit your claim, like I say, you do it through the HMRC online portal. I would hope that the majority of employers will already have a login for that portal and will already be set up. So you simply log in using your normal government gateway ID and your password. Once you're logged in, you can then make your claim. Now I have put on here, really important to know, you can only make one claim during each claim period. The reason I draw attention to that is because it's so important to make sure that every single employee you have furloughed has been included on that one claim form. Once you click submit, you cannot go back in to edit or change the claim. So before you submit it, make sure everybody's been included. How that information is submitted actually depends on the number of employees you furloughed. If you have furloughed less than 100 employees, you will need to submit each employee's details separately. And there is a list on the government website of what information you need to have to hand for each employee. If you are submitting a claim for more than 100 employees, they've made it a little bit easier, and you can actually upload a file containing all of those employees' information. Once your claim's been submitted, it will of course be processed and checked, and the government are currently aiming, they've got a turnaround time of 6 working days. So you should receive the grant within 6 working days of submitting your claim. And I'll just finish off by saying that if you do have an agent that works on your behalf for your payroll purposes, they can submit the claim on your behalf. So if you do have an accountant or a payroll provider that you work alongside, get in touch with them to explore what support they can offer when you're placing your furlough grant. That's everything from me for now. As I say, I'm going to hand back to Matt now because we've had a really high volume of questions on this area, not only during the webinar, but also just from clients in general. So I believe Matt's got some frequently asked questions for me, and then we're going to run through some other questions as well, Matt.
Yeah, that's right, Claudia. So as you mentioned, we've taken a few questions, a few of the most frequently asked questions from our clients because Claudia and her colleagues have been bombarded with questions during this period. So we've taken some of them and pre-prepared those to help with this presentation. So I'll go through those now. One of the most common ones is about volunteering or training during the furlough period, Claudia. So if you could touch on that.
So I'll start off with volunteering. So I mentioned during the presentation that when an individual is placed on furlough, they should not be undertaking any work that is providing a service or generating revenue for the business. So if the volunteering work means that they will end up doing one of those two things, they shouldn't be volunteering. However, they can partake in volunteering work as long as it's not providing a service or generating revenue. So there'll be certain things they can do. The second point around training, the government are actually encouraging employers to offer training while their staff are furloughed. It's a useful thing to do to keep everybody in touch with the workplace and keep their skills and knowledge up to date. It's actually good to use this time to maybe undertake training that you don't normally have time to do. So you definitely can ask staff to undertake training. You just have to make sure that for any hours they've spent training, they receive at least the national minimum wage for those hours. So in most cases, even the grant that they receive of 80% of their wages, it'll still be meeting the national minimum wage anyway.
Okay, thanks for that one, Claudia. The next one is, what if my employee has more than one job?
Okay, so the answer is you treat each job completely separately. So an individual can be furloughed from one job and still be working in another. So that could be, they could have jobs at two separate places and be furloughed at one, working at another. It could even be for the same employer. If they've got two jobs, they could be furloughed from one and continue working in another. Just treat them completely separately.
Okay, brilliant. And the next one on the frequently asked questions, what about those on maternity leave or any other statutory leave?
Yeah, we've had a lot of questions around maternity leave. So this also applies to paternity leave, adoption leave, shared parental leave. The answer is treat it exactly the same as you always would. The same rules apply. So if you've got somebody who is returning from maternity leave and everyone's been furloughed, you can furlough that person from the date of their return. Equally, if you've got somebody who's due to go on maternity leave, like I say, the same rules apply, so just treat it the same as normal.
Okay, brilliant. And bank holidays and people who had booked holidays.
Yeah, this was a massive question, especially given that we've just had the Easter bank holidays. We've got another bank holiday coming up this Friday. The government remained completely silent on the topic of holidays for a really long time. We only saw guidance published on this. It was the middle of April, I think it was the 19th of April, they published the guidance, and they finally confirmed that staff can take holidays during furlough. So before we had that guidance, we were very hesitant to advise our clients that it was okay for somebody to take a holiday during furlough. We weren't sure if that would have broken the furlough period and stop you claiming the grant. But we now know that you can take holidays during furlough. If your employee does take a holiday during furlough, you just have to make sure that they receive their normal holiday pay for that day's holiday. So in some cases, you'll just be making up, you can still claim the 80% grant, and then as the employer, you will just need to make up the extra 20%. Or there will be a lot of people who calculate holiday pay based on an average of hours worked. So if that's the case, like I say, you can still claim the 80%, and then you just need to make up the difference.
Okay, so that's interesting. So if you was on furlough for 3 weeks and took 1 week off, you would need to be paid full for your actual annual leave for that 1 week?
Yeah, any
Right,
holidays
okay.
taken, anything down as holiday, make sure you receive your usual holiday rate.
Brilliant, thanks Claudia. One more on there. Can I rotate people on furlough?
Yes, you can rotate staff on furlough. Yeah, the answer is yes. I'll explain what that means a little bit more just for anyone who doesn't understand. We have had a lot of questions from people. Rather than have to select a certain number of staff to be furloughed and a certain number of staff to not, there are a lot of businesses, for example, who have reduced their workforce by 50%. So what they've looked to do is to furlough 50% of staff for the first 3 weeks, bring them back to work, and to then furlough the other 50% of staff for the next 3 weeks. So you're sharing it out equally amongst everybody. So it's absolutely fine to rotate people on furlough, as long as each time someone's furloughed, it's for 3 consecutive weeks at a time.
Excellent, thank you. Can employees seek work elsewhere whilst furloughed?
Yeah, absolutely. There's nothing in the guidance to stop them from doing that. So as long as your contracts of employment don't prevent them seeking secondary employment, absolutely fine for them to do so.
Good stuff. And one more on the frequently asked questions before we move on to some of the attendee questions. There's a lot of people questioning the national minimum wage at this particular point. So if someone's on the national minimum wage and they have to be furloughed, can the company reduce that by 20% to the 80, or do they need to make it up to the national minimum wage?
Yeah, so really simple answer to that question, and that is the national minimum wage rules apply for hours worked. So an individual's only entitled to the national minimum wage for hours they have spent working. Whilst they're furloughed, they shouldn't be undertaking any work. So it's absolutely fine for that to drop to 80% of their normal rate.
Great stuff. Thanks, Claudia. That's really clear. And so we'll move on to a couple of the questions that we've been asked during Claudia's presentation. One of them actually ties in really well to the frequently asked questions. So I have a team of 10 engineers. Due to the COVID-19 outbreak and the measures put in place by the government, I've only enough work for 5 of them. Can I furlough only half of the team, or do I have to furlough them all?
Yeah, you can choose to furlough just half of your employees. Like I say, if you were going to look to do that, one option could be to rotate staff on furlough. So you could furlough 5 of them for the first 3 weeks, bring them back to work, furlough the other 5 for the next 3 weeks. So yes, you can furlough some employees and not others. You don't have to furlough everybody.
Excellent. And the second part of that question, if I can only furlough half the team, how do I go about choosing which 5 to furlough and which 5 to keep working?
Okay, so as I say, one option is rotating them round, so you don't have to make a selection. If that won't work for you, other options, I would first of all ask if anybody would like to volunteer to be furloughed. There will be some people, because of their personal circumstances, who probably would rather be furloughed at this time, especially if they've got children at home or if they live with vulnerable people. It might actually benefit them to be furloughed. If you don't have enough volunteers come forward, if you are forced to make selections, then we recommend using some sort of objective scoring criteria. So very similar to if you've ever gone through a redundancy process and you have to choose somebody to be made redundant, you would use some form of objective scoring criteria. So you would be looking at their skills, their knowledge, their abilities, and what you need in the workplace at that time. If anybody's looking to do that, we can provide you with examples of the types of scoring criteria you can look to use and how to do that in the most objective way.
Great stuff. So that would just be an email to the designated consultant, would it? Or the admin at Starlight Team? Yeah, brilliant.
Yeah, either of those things, yeah.
Excellent. So one more question. It's got a few dates in it, so bear with me. If you need me to repeat it again, just let me know. So I have an employee who began employment with us on the 2nd of March, 2020. We continued to work until the 13th of March, 2020, when the office shut. We paid him his first wage on the 27th of March. Are we now able to place him on furlough and claim 80% of his wages through the scheme?
Okay, so although if that person was employed on the 2nd, they were employed before the 19th of March. So I'll just reiterate that to be eligible to be furloughed, you have to be on the payroll on or before the 19th of March. So it sounds to me like this individual was employed before the 19th of March, but if they weren't paid until after they most likely will not be eligible to be furloughed.
Right, okay, so that's based on the first payment as opposed to the actual employment date.
Yeah, it's not necessarily your start date, it's whether you were on the payroll or not by the 19th.
That makes sense. And one more, Claudia, before we move on to the poll. I've furloughed some of my employees but need to bring them back next week to undertake an urgent job. Can I furlough them again after the job is complete? And if so, how soon can I do this? Would they have to be back at work for 3 weeks first?
No, they don't have to be back at work for 3 weeks first. The 3-week rule is just the minimum that somebody can be placed on furlough. So you can bring them back to work to undertake that urgent job, as long as it's safe for you to bring them back to work. So I'd refer back to Sue's presentation and make sure that you've got all the correct measures and precautions in place. You can bring them back to work, have them undertake that job, and then you can place them on furlough again. So like I say, the scheme is open till the 30th of June. There's no minimum period they would have to be brought back for before they can go back on furlough. Just make sure that whenever they are, again, it's for 3 consecutive weeks before you bring them back.
Great stuff. And that was quite a long question. There was just one more part to it. So also, what happens if 1 week into a new furlough period, more urgent work comes in and I need to take staff off furlough again?
Okay, into a furlough period. So like I just said, furlough has to be for 3 consecutive weeks for you to be eligible to claim the grant from the government. If you bring them back sooner than that, you are not going to be eligible to claim the 80% grant. You could bring them back sooner, but just be aware that you then can't claim the support from the government.
Excellent. Thank you for answering them, Claudia. I know that was quite a few questions. So one more poll, guys. Just bear with me. So we have had a couple of questions about the poll results. These will be collated and published as part of the resources and content along with the presentation and the recording of the webinar. So please bear with us with the results of the poll. They will become available to you all upon completion and when the recording of the webinar is available. So I'll give this poll a couple more seconds. And if you would just really kindly complete one more with just some feedback on the webinar, that would be much appreciated, guys. I've just launched that poll now. Any feedback is much appreciated. And like I said, the webinar will become available in the coming days. We'll email a link to all of the attendees with where to find that recording. If you've got any queries at all that have not been answered, or if you've got any urgent questions that have not been answered during this webinar, please feel free to get in touch with your designated consultant, or if you're not a client, please feel free to email admin@skaltd.co.uk or contact our office number. People are still answering the office number. It is going to a select number of employees, so your calls will be answered. Any other coronavirus news and updates, please visit our website with the coronavirus-advice section. And thank you once again, guys, for joining us. It's been, I hope you find it very useful. It's been a pleasure delivering it for you. And thank you very much.